have a graphic I'd like to show our viewers and the procedure, and you correct me if I say this incorrectly, doctor, but it's pyloromyotomy?
Pyloromyotomy, that's
Okay.
right. That's basically an incision just in the muscle wall of the pylorus, so we don't go all the way into the inside of the channel. We leave the mucosa and the submucosa intact, which is the inner lining of the pylorus, and we just open up the muscle so that the ring around the pylorus is basically broken along one line.
Is this laparoscopic, doctor?
We
the
do it
procedure?
laparoscopically as well, yes.
How long does a baby stay in the hospital, and how uncomfortable is the procedure? Obviously, the baby cannot talk or say anything, but how is the outcome?
Well, the surgery is done through, we place a scope, a telescope through the umbilicus, which that's the belly button. And then we make two small stab incisions in the upper abdomen, one on the left and the right. So the incisions are very small. What limits the baby from going home is being on full feedings and tolerating these feedings. It's not uncommon even for the baby to vomit following the surgery, and we always warn the parents. The stomach has not been functioning properly for days to weeks, depending on when they come to the hospital. So there is a gradual process at the stomach, and it needs to regain its normal function.
Jennifer, I'm going to bring, doctor, I still have a couple questions for you, but I was just thinking, as a mom, the emotional component of something like this. I mean, you just had a baby, and I believe around 3 weeks, 4 weeks, they're going into surgery.
Sure.
Surgery is surgery. There must be a difficult emotional, psychological. How do you help the parents? Because that's not easy.
It is difficult for parents, especially moms. These babies are very young. Typically, the moms still can have a lot of hormonal imbalances after births. We really, try and support the family. We have a great team of surgeons, fortunately, that I think the families feel very comfortable and confident with. And post-operatively, other than some vomiting, they'll slowly advance their feeds, and they will do well, and they go home rather quickly. So I think all in all, it typically winds up to be a good experience, and we're really just there to provide support as best we can.